Telemedicine and virtual care allow employees to connect with physicians and other healthcare providers via a different outlet than in-person care. Employees can utilize services using telephonic or online face-to-face visits without using the traditional vehicles. Telemedicine and virtual health can save money to both employers and employees. Employees save money by having a lower cost at the time of service, where a lot of these can actually be free to the employee based on what the employer decides. Otherwise, if they're using other traditional venues such as urgent care or emergency room, a lot of times there's a higher copay or a coinsurance that an employee has to pay. Typically, if they're also using it for other services such as behavioral health or musculoskeletal care, again, a copay would apply. A lot of employers, when using digital or virtual medicine, tend to reduce the copay because they know on their end it's going to also save them money. Typically, claims tend to be lower in a virtual care setting versus in the traditional in-person care. A lot of employers are already used to, and employees are used to, the traditional telemedicine venue where you have a sore throat or maybe an earache or your child's sick in the middle of the night, and you can reach out to a telemedicine provider and get a prescription filled within a 30-minute period. We're seeing that there are a lot of new emerging telemedicine offerings through a lot of different venues specific to mental health and access to care, as well as musculoskeletal conditions where employees can have access to physical therapists via an online portal with certain sensors that can help the physical therapist on the other side ensure that exercises they're performing are being done correctly. We're seeing that this is helping with adherence to ongoing acute and chronic conditions for employees, as well as allowing them to have the opportunity to do this in their home, where they don't have to actually go to a traditional physical therapy office to continue their care. As I mentioned above, there are cost savings both to employees and employers by implementing virtual care and telemedicine. Typically, the utilization of these programs costs less on a per occurrence basis, and outside of the medical plan can again reduce the cost of the traditional venue of care. We also see that the value of these programs is it's allowing employees wider access to doctors and providers for different needs, and this is allowing employers to give a more well-rounded program across all generations of employees to help increase productivity by allowing employees different places to access care at different times of the day, and help attract and retain employees by putting these into your existing programs. If you're interested in enhancing your telemedicine virtual care offerings, CBI can help you identify which programs may be the right fit for you.